We are going to have a wonderful session today. So be ready for everything. Take your time and spend as much as time as you can. Yes. So there we are. Pneumonia. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today I'm going to conduct a reading episode number 1, Pneumonia, multiple choice questions. 60 seconds. Yeah, now we are moving to part text B. Text C. Text D. Now we'll move to the questions. So 1 to 7 questions, right? We are going to see 1 to 7 questions now. Now, let us analyze the questions. Texts. Now, text A. Now, think about what concept this is. So, the title is pneumonia. The title is pneumonia. Now, think about text A. What title can you give this one? What title can you give this one? Text A. Write down in the chat box. Write down in the chat box. Yeah. Title. Title is pneumonia. We know that. Title is pneumonia. Now let us see. Text A. What title can you give? Come on. What title can you give for text A? Come on, write down. Think and write, no problem. Even if it is wrong also, no problem. Nobody it is going to bother. Yeah. So think and tell me. So this is how you will learn. So participate. I'm teaching you how to respond. Just participate. Yes, four people have given. Okay, you have given the title assessment. Very good. Assessment. One word. Assessment. Yeah, that's it. Let us take assessment. Okay. Assessment, admission, and discharge. So, admission also we need assessment, and discharge also we need assessment. So, the main title is assessment. Assessment, admission, and discharge. Admission time assessment, and discharge time also assessment. If you do not assess, you cannot admit. Okay, you will admit only if there is a problem. How do you know the problem? How do you know the problem? That means you are assessing. If you assess, then you will know the problem. Then you will admit if the problem is there. Now, after admission, so you will again assess. If still the problem is there, then he will continue there. If the problem is eliminated, solved, then there will be discharge. So again, assessment is there throughout. At the time of admission, at the time of discharge, every time assessment is there. So we can take the title assessment. Very good. Now next, let us see the second point. Text B. Text B. Yeah, text B. Now think about this one. What you want to say about this? What title will you give to this? What title will you give to this? What title can you give to this one? Text B. Come on, all of you, write down. Yeah, text B. Information to give patients. Community acquired pneumonia. So, what title can you give? One word title only. One word title. So, information, details, information. Okay, information. Okay, majority of you said information. So, let us take information. Next, C. Yeah. Next, C. C. What title can we give C? Text C. Text C. Yeah. 5 people have given the answers. Okay. So it is procedure. Procedure. Yeah. So we can take procedure. Here it is there. Procedure. Next, text D. Text D. What title can you give for text D? Text D. What title can you give for text D? Yes. Now, fine. Now that's it. What have you given? Let me see. So you have given me treatments. Complication. Yeah. Majority of you have written complications. Okay, that's it. So now let us take the 4 titles. We'll take the 4 titles here. What are the 4 titles? Now let us see that. So here we'll write text A. So title is pneumonia, we know that. Text A is about what is that about? So let us see what you have given the answers. So test A is assessment. Yeah. Test A is assessment. Test A is assessment. Next, test B is information. Test C is procedure. Text D is complications. Yeah. So remember these 4 things. Remember these 4 things. Keep these 4 things in your mind. Yes. Here you are. Focus on these things only. This is very, very important. Top right corner. Okay. So these are the options A, B, C, D. So these should be on your mind. Every time you don't need to turn the pages. I'm not going to turn the pages. This is fast forward learning style. Fast forward learning style. Now let us see here. You have to think about these 7 questions now. Now, what are the most important words here? You have to see. What are the most important words? The typical recovery timeline for pneumonia. So, timeline. 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 The typical recovery timeline for pneumonia. Remember that. So, next, the definitions of medical terms related to pneumonia. Definitions. The definitions. Okay. The definitions of medical terms related to pneumonia. So, medical terms. The equipment required to carry out a specific procedure. So, procedure. Procedure. The equipment required to carry out a specific procedure. So, equipment. Equipment is another word. So, the important words we are bothered. Okay. Here, medical terms, another word. And here, recovery, another word. Just giving you, selecting important words here. Patient guidance regarding medication side effects. Patient guidance regarding medication. Medication. Okay, side effects. This is guidance. Guidance regarding medication side effects. The next one, how to decide whether a patient should be hospitalized. Hospitalized. How to decide. Okay, think about these words which are underlined. They will help you to understand which paragraph you will go, A or B or C or D. The underlying cause, the underlying cause of some conditions associated with pneumonia. Cause of some conditions, that means medical conditions. Next, the type of patient for whom the standard evaluation will need adapting. The type of patient for whom the standard evaluation need adapting means adjusting. Okay. So these are the words. Now think. Now think about these things. Okay. Now think about these things. Right? Question number 1. The typical recovery. So question number 1. Let us see. Question 1. Now, you tell me. Question number 1. You tell me. Is it A or B or C or D? You type. A, B, C, D. Anyone you can type. Write in your notebook. Just guess. Afterwards, we'll check how your guesswork is working, how your brain is working. Is it working in the proper way or not working in the proper way? We have to find out. Just guess. Guess logically. If it is right, it's okay. If it is wrong, we'll learn. That's all. There is no harm. Okay. So that is question number 1. Okay. All of you respond. So, Emmy, Dunisha, Sinsi, Shams, Ruina, Anoja. Anybody else? Write down. Next. Question number 2. Question number 2. Yeah. Only after I write question number 2, then you have to submit the answer. Otherwise, we will not know whether it is question number 2 or question number 1. We'll think that it is question number 1. If you write after my question number 2, then it's okay. Before, if you write, then it will go to previous question. Remember, all of you think and write. Think and write. The definitions of medical terms related to pneumonia. No need to put the number. Already I put, na? Just put ABCD. Okay, very good. Come on, come on. Anybody else? If you missed already, first question, then you can write this one, like that. Okay. Right. Next. Question 3 is here. Question 3. Come on. Question 3. Yeah. Next. Question 4. It's okay, I'll teach you. But first, I'm just checking how you should know how your mind is working. Then afterwards, when I teach, then you'll understand how your mind should work. That's all. If both are same, then that means you are the winner. Okay. That's question 4. So question 5. Yeah. Question 6. Yes. Question 7. Right. That's very good. Now, you write down these answers in your notebook. Whatever answers you have written, you can write down in your notebook. Now we'll check the answers. Okay. So here it is. Pneumonia, assessment, information, procedure, complications. Okay. Assessment, information, procedure, complications. Right. So now we are checking the answers. Yeah, these are the answers. Check. Check your answers. Check your answers. Now your scores. Okay. Your scores out of 7. Come on. How many marks you got out of 7? There is one Ruvini, there is one Ruwani. Confusion name for me. Okay, come on, write down. If it is less, no problem. Okay, that's no problem at all. We learn. Yeah, update your scores. Update your scores. Yeah, yes, very good. So these are your scores. These are your scores. So this is how your mind is thinking. Now let us see how it is going to work for us. Let us analyze how it is going to work for us. Okay, right? Yeah. Now, question number 1. You got 4, 5, 6, 7. Very good. Now we are going to this question. Now let us see. Yeah. Now let us check this one. The typical recovery timeline for pneumonia. The typical recovery timeline for pneumonia. Now, let us see here. Recovery timeline. So, is it assessment? Is it information? Or is it procedure? Or is it complications? So that you have to see. Now, the typical recovery timeline. The typical recovery timeline. So, for pneumonia, how much time it will take? How much time it will take? It's timeline. Timeline. So, timeline is not in procedure. Timeline will not be in complications. Complications means problems. So D will talk only about problems, complicated situations. C, procedure, how to manage this. That's it. So how to manage it. It's not how much time it will take, it's how to manage it. So next, A, assessment. Assessment means, okay, assessing, checking, evaluating, okay, diagnosing, checking, studying, researching, assessment. Okay, that is A. Now remaining information, okay, information, general information, how much time it will take, how you will identify. So like how much time it will take. That's important here. So therefore, now how to go to this one? Now let us go question by question. Now here, what are the key words in the question? Number one, for every question you have to ask these questions, 4 questions. For every question, you have to ask 4 questions. What are those 4 questions? Now let us see. What are those 4 questions? Right, number one. Number one, what are the key words in the question? What are the key words in the question? Number two, you have to ask these 4 questions. What is the operating word which points the direction? Yeah. Which points the direction. What is the operating word which points the direction A or B or C, directing to something? Next, number 3. In which text will we find the answer? This is the third question. In which text can we find the answer? In which text can we find the answer? Right. Next, fourth one. Okay. Number 4. What is the reason? So these are the 4 questions you have to ask. If you ask these 4 questions, then you can get the answer. So better ask these 4 questions always. Fine. Yeah. There you are. 4 questions. Now let us ask one by one. Let us ask one by one. Question number 1. The typical recovery timeline. The typical recovery timeline for pneumonia. Yes. The keywords are timeline. The keywords are timeline and recovery. Timeline and recovery. So timeline and recovery. Timeline and recovery. Now if you see timeline and recovery, So, typical recovery. So, we can take this together. Typical recovery timeline. So, these are the three words: typical, recovery, and timeline. Now, here, that's number one. What are the keywords in the question? Typical, recovery, timeline. These are the three keywords. Now, what is the operating word? What is the operating word? Okay. What is the operating word? Operating word is what? Timeline. The operating word is a timeline. The operating word is a timeline. Yeah. Timeline means from the time it starts, what is this stage, what is the next stage, what is the next stage, what is the next stage, and what is the last stage, like that. So timeline. In the beginning, it will be like this, next it will be like this, next. So this is called timeline. First month, second month, third month, fourth month, or first week, second week, third week, fourth week, like that. So that is, you have to see there. It's telling how it is progressing. It is telling how it is progressing. It is not telling anything about evaluation. It is just giving information. The typical recovery timeline is like this. It's just giving some general information. Recovery, typical recovery will be, for example, 4 weeks or 6 weeks or 8 weeks. First week, when you go to the doctor, first week it will be this much. It will reduce to 80%. Second week it will reduce to 60%. Third week it will reduce to 75%. Fourth week, total finished, 0%. So, timeline. It's just giving information. It's giving facts. It is not evaluating. It is not evaluating anything. It is not assessing anything. It is not diagnosing anything. Already diagnosed. Diagnosis is finished. Now recovery is needed. Infection is over. Problem is already got. Problem. There is a problem already. So only after the problem, then the recovery. How do you know? It is after assessment, not in assessment. It is after assessment. Then only you start treatment. Then when you are starting treatment, you will tell the patient, this is how the recovery will take place. You will not tell a person who is not diagnosed with pneumonia. You will tell a person who is diagnosed with pneumonia. Okay. For example, I don't have pneumonia, then I will not go to the doctor. I will not ask the doctor anything about recovery. If I am affected with pneumonia, then only I'll go to the doctor. Then I'll ask him, what is this, doctor? Because I don't know. Then he'll say it is pneumonia. Then I'll say, what will happen now for me? How much time will it take? So that means I am asking information. What will happen to me and how much time it will take? So I'm asking information. When I'm asking information, the doctor will give the required information. I require how much time will it take to recover for me? Is it 2 months? Is it 4 months? Or is it 6 months or 10 months? So I'm asking information. And the doctor is telling, yeah, normally the recovery will take 4 to 6 weeks. Sometimes, if you are not compliant with medication, it may take even 10 months or even a year. So it depends on your medication compliance also. So the recovery, if you are compliant, it will take 6 weeks or 6 months, whatever. So the doctor is giving information based on his knowledge. He is not assessing because it is already assessed, already diagnosed. Assessment means what? Diagnosis. You're assessing, evaluating, checking, finding, researching, and you declare that it is pneumonia. Already diagnosed. Assessment over. Then only the patient is asking, nah? Try to understand the logic. So you're asking, how much time do I need to recover fully? So it may take 6 to 8 weeks. Is he assessing here? No, he is not assessing here. He is just telling you how much time it will take. So timeline, how much time it will take. So he knows, he already has the information, the doctor. He is giving the information to the patient because the patient doesn't have any idea about it. He doesn't have any information related to this problem. So he is asking for information and the doctor is giving the information. It will take this much time. Now try to understand the difference between assessment and timeline. Okay. Only after it is assessed, you will ask how much time. So timeline comes after assessment, not in assessment. Okay. Next, procedure. Procedure is what the doctor should do. It's not how much time it will take, what the doctor should do. What is the procedure? What are the steps involved? What is the first step? What is the next step? What is the next step? What is the next step? What type of medication is given? What type of treatment is given? Physiotherapy is there or hydrotherapy is there? What all? That is procedure. There's a process, step by step procedure. It is a step by step procedure. So, is it timeline? No. It is not timeline for recovery. It is not even timeline. It is procedure. First, what we have to do. Next, what to do. What you have to do. Next, what you have to do. Okay. We can say it is a flow chart. Okay. Step by step. It's not talking about time. It is step by step. What should we do first? What should we do next? That's all. The various steps involved. So this is not regarding the step involved to treat pneumonia. Okay. It's just about time, how much time it will take. It's not talking about treatment or procedure or anything, surgery or anything. No, nothing related to that. It is just related to the time to come out of this problem. Next, complications. He's talking about recovery. Where are complications here? There's a totally new topic. So A, no, it is not assessment. It is after assessment. Timeline. How much time? Information. Yes, information. It's time. Information regarding how much time it takes. Yeah, B is right. See, procedure. Procedure are steps involved for treating, for managing the condition. The steps, the process. And complications is totally different thing. Problems. Okay. So recovery is going on. So what complications here? So that's how. So here, this timeline is talking about information. This timeline is talking about information. Remember that. So now let us see. If you go to text B, you'll find there first week fever is resolved. First week fever is resolved. So here it is see timeline. Time 1 week, 2, 4 weeks, 6 weeks, 3 months, 6 months. So total back to normal. Back to normal. Total recovery. So it takes 6 months. Okay. 6 months. Most people will feel back to normal. Most people, not all. Some people may take even 7 months, 8 months, 1 year also. Okay. So try to understand what I'm saying here. Timeline is here. Okay. Information to give patients how much time it will take. So don't panic. That's what you have to tell them. Next. So is that clear? Question 1. Explanation. Is that clear? Come on, respond. I think it is very clear. So you need not go always. Only to check you have to go. First you have to apply logically. When you read the question, you have to think like this. Then you'll get confirmation. If you apply like this knowledge, it will be easy for you. Remember that. It will be very, earlier also I taught, but that time I taught different style. Every time I take a lecture, I'll teach different styles. So don't worry. Okay, next. Now let us go to question number 2. Question number 2, okay. So the question number 1 is A. Question number 1 is A. Okay, fine. Next, question number 2. The definitions of medical terms. The definitions of medical terms related to pneumonia. The definitions, yeah. Think about this now. What are the definitions of medical terms related to pneumonia? Definition. So definition means what? So medical terms. There are some medical terms. There are some terms, means some names. Medical names related to pneumonia. What type of pneumonia? Some medical terms related to pneumonia. Okay. Now what are the definitions of these terms? Terms means names. Definitions means expansion or meaning or clarity, purpose, phrase or sentence meaning. The definitions of medical terms related to pneumonia, not pneumonia, but related to pneumonia. For example, a person has pneumonia and he has lot of fluid in his lung. So that condition, there is a name of that condition. Okay. There's a name of that condition. So different conditions of pneumonia. So they have different names. Now you see the title here, the important words here. The important words are 3 number. Let us take 2-3 words here which are very important. First one is definitions. And next one is medical terms. Definitions and medical terms. So definitions of what? Of medical terms. So medical terms means some labels, some names of medical conditions which are resulting from pneumonia. Because of pneumonia, they have some other medical conditions. What are those names? What are those titles? So now you have to understand that. Now here, definitions. Definitions means explanation of the terms. Definitions means explanation of the terms. Try to understand this. Now, you see, now where you will find these terms? There are some complications, complicated conditions, medical conditions which are very complicated. So medical conditions which are very complicated, and there they have given some names and they have given some explanation. So will you find this in assessment? No, this is not in assessment. Assessment means whether he has pneumonia or not, right? The next one, information. Is it just information giving to the patient? No, it's not information given to the patient. Definitely, it is the definitions, right? Next, procedure. Is it step-by-step procedure? No. Medical terms. This is this problem, this is this problem, this is this problem. That's why we gave this name, because they have this medical condition. medical conditions related to pneumonia. This particular person has pneumonia, and because of this, he has this side effect, and he has this side effect. So this side effect name is this one, this side effect name is this one. So that is called medical term, medical terms. Now these medical terms, why giving special names to these? Because these are special problems. These are special conditions, special issues. It's not just pneumonia, it's more than pneumonia. So it is, pneumonia is already a problem. This is more than pneumonia, means more than a problem. That means serious problem. Serious problem means complications. Serious problems means complications. You have to understand like this. Okay. For example, in the text D, you have a list of table, a table. You have a table there, right? So terms, medical terms, labels. So pneumonia is already there, related to pneumonia. He has pneumonia, and this has developed into a more serious problem. More serious problem than pneumonia. Pneumonia already is a problem, 100%, and this has given another side effect, another medical condition because of this one. So that is not just a problem, but it's a complication, a serious tone. This is not assessment. Assessment of pneumonia is already done in the beginning only. After assessment, then when there is pneumonia, you'll find out some other things. That is complication. And there is some problem is there. What type of problem? You will know the name. You will have a term. You will have a label, or you will have a title for that one. Oh, mucus in the lungs. What is the name of that? Like that. For example, you have to study those things. For example, there are many medical conditions, which is a table of complications. For example, if you go to text D, let me take you there. Text D. Bacteremia, see complications. Complications. Bacteremia. What is bacteremia? Definition. Presence, multiplication of bacteria in the bloodstream is called bacteremia. That means there is bacteria in the bloodstream. Already has pneumonia. And along with that pneumonia, there is another problem, that is bacteria is present in the bloodstream, and this bacteria is multiplying in the bloodstream. This bacteria is already there in the bloodstream, and it is multiplying. Multiplying means increasing in leaps and bounds. That is the explanation. In the same way, if you see ARDS, acute respiratory distress syndrome, what is this? It's buildup of a fluid in the alveoli. That's the explanation. Buildup of fluid in alveoli is called acute respiratory distress syndrome. Alveoli. So there, fluid is concentrated. All the fluid will go into the alveoli and are stored there. So because of that, breathing will be a problem. So this is not just pneumonia. This is more than pneumonia here now. Now, pleural effusion. What do you mean by pleural effusion? Pleural effusion means accumulation of a fluid in pleura. That is the definition. So there are medical terms and there is definition. You can see for each and every. Pleurisy. Pleurisy means inflammation of pleura. So that is called pleurisy. Emphysema. Emphysema means infection of the fluid. Next, lung abscess. Formation of pus in a lung cavity. So these are all medical terms. 1, 2, 3, 4, 5, 6 medical terms are there. And along with the medical terms, after the medical term, there is the definition or explanation in simple terms. That's the way how you have to think. So when you go and check, you have to only go for confirmation. First you think like this one, then go and check. Go and check. If it is right, that's right. If it is wrong, then again check. So this is how you have to understand. Next, question number 3. The equipment required. Yeah, so that is definitions and medical terms. Now, third question. Third question is the equipment required to carry out a specific procedure. Now, the keywords in the question are number 1, equipment, specific procedure. Right. Equipment, specific procedure. This is a straightforward response. Straightforward response. Procedure, procedure. Direct. No need to panic even. So procedure, procedure. What is that confusion here? So what is the equipment required to carry out a specific procedure? So you have to understand now. Is it an assessment? No, because you do a procedure after assessment, not during assessment. During assessment, you do a procedure? No. Procedure is treatment modality. Assessment is diagnostic modality. First you do diagnosis, then you take procedure. Try to understand the steps, right? So procedure. Now let us go and check. Specific procedure. See, is procedure. That's it. Thoracentesis procedure. Thoracentesis procedure. What is the equipment used? What is the equipment used? See here. Use a 25 gauge needle. Use a 25 gauge needle. That is one equipment. Okay. Then check if there is another point also, something like that. What is the equipment used? Okay. 18 gauge over the needle catheter. Point number 7. Catheter. There is a catheter. Then in 4, there is a needle. Then next 7, catheter. So equipment. Fine. You should not say equipments. Equipment, that's all. You cannot say equipments. If it is more than one also, you cannot say equipments. You have to say equipment. 2 pieces of equipment. Okay. Or 3 pieces of equipment. Different types of equipment, not equipments. Remember that. So, you can see here. So use a 25 gauge needle. Here it is, 25 gauge needle. So needle is 1. Then attach an 18 gauge over the needle catheter. Okay. So here it is, catheter. So like that you have to analyze. Attach a syringe. Syringe is there here. Okay. So 3 points here. So one is needle, one is catheter, one is syringe. Okay, fine. So the equipment required to carry out a specific procedure, that's what he's asking. So these are different types of equipment. Fine. So carry out a specific procedure, that you have to see. Next, question number 4. Patient guidance regarding medication side effects. Okay. So equipment, 1 minute. So the words are equipment and procedure, specific procedure. So tools, equipment means what? Tools or items used in a medical procedure. So in which text will find? That will find in C. So thoracosynthesis procedure, the title itself is procedure. So you have 25 gauge needle, 22 gauge needle, then 18 gauge over the needle catheter, syringe with a three-way stopcock, and collection bag, etc. All these are items. All these are equipment. Okay. So there are many things. Even if you see one, that is enough. The answer is right. Next, question number 4. Question number 4. Yeah. Patient guidance regarding medication side effects. So try to understand this. So medication, when will you give medication? After assessment. So A, assessment is wrong. Medication. Medication. Medication is related to what? Procedure or treatment. Okay, so C is gone. Side effects. So you will tell about the side effects. So where you will tell? Patient's guidance. You are guiding the patient. Okay. He's asking what are the side effects? If I take, what will happen? If I don't take, what will happen? What are the side effects? What are the problems I'm going to face? So the patient is asking information. So the doctor is giving the information or the nurse is giving the information. So it is information because patient doesn't know. So patient has to know. So somebody has to give the information. Who will give the information? The medical professional. And he will give the information to the patient. So patient does not know anything. The medical professional knows everything. So whatever information, whatever knowledge the professional has, whatever wisdom they have, whatever ideas they have, all these things they will tell the patient. So information, knowledge. So who has the knowledge? Definitely not the patient, because he doesn't know. First time he is facing this problem. So he doesn't know anything about pneumonia. So he'll ask, doctor says, doctor, I came to you, I have some this problem. Then doctor runs some tests and he'll say, you have pneumonia. Then the patient asks, oh, doctor, now what I should do? Okay, I'm going to give you medication. Okay, are there any side effects of this medication? Yeah, there are some side effects. So now here, the doctor in the beginning, he assessed the patient. So he has pneumonia. Now he has given medication. So that is a procedure, a treatment. Then afterwards, he has given some medication. So after that, the doctor, patient will ask, doctor, I am taking this medication, but are there any side effects to this medication? Will I feel drowsy or sleepy, or what exactly is going to happen? Then doctor will tell him. He will provide guidance. He will give information, all the knowledge related to medication side effect. Yeah. If you take too much, you will feel drowsy. So that is a side effect. So that means the doctor is giving the information to the patient that he will feel drowsy. So side effects, drowsiness. You have pneumonia, I'm giving you medication. You take this medication, you'll get these side effects. So that is information regarding, okay, information regarding, yes. So, information is given to the patients. Remember that. So, fourth one, so guidance. That means you guide somebody when the other person doesn't know. I don't, for example, I come to the UK, then I'm standing at the on the main road. Okay. And somebody saw me, you saw me. You will ask me, why are you standing here? I say, I want to go to Heathrow Airport. Then you will say, okay, you want to go to the Heathrow Airport? Okay, I will guide you. Why he will guide you? Because you don't know, right? So he's giving you guidance. He's guiding you. That means he has knowledge, he has wisdom. Okay. And he's guiding you. He has knowledge, he has wisdom, he has all the information. You don't have wisdom, you don't have knowledge, you don't have any of the information, 0% knowledge regarding how to go to Heathrow Airport. Where is Heathrow Airport? How many kilometers from here? How will I catch the bus? How will I reach there? How much money I have to spend? All this information I do not know. So you are guiding me because you know everything. So try to understand here. Guidance means giving information. Guidance means giving information. So remember, you are giving information regarding the side effects of medication. Yes. Yeah. Guidance, medication, side effects. Yeah. Guidance. Who needs guidance? A person who does not know, a person who doesn't have information related to anything. That person needs guidance. Who needs guidance? Patient need guidance. Who is giving guidance? The doctor is giving guidance. So, giving information is called guiding somebody. So, you have to understand this one very clearly. So, are you all with me? Is that clear so far? Is that clear so far? Come on, just respond. Respond. Even if you write one letter, yes, also okay. S, one letter, no problem. But respond, please. Respond, all of you. Sinsi, Shams, Shamali, Ruvini, Emmy, Dunisha, Dinusha, Aruja, Anuja. Very good. Yeah. So, you're able to understand. That's good. Now, let us go to, yeah, patient guidance regarding medication side effects. Now, go to B and check and confirm. First, you have to think like that and go to B and confirm. Medication side effects. Medication side effects. Okay. Medication side effects. Where do you have medication side effects? You can see there. You can see there. Side effects. Side effects. Side effects. Effects means reactions. Medications means antibiotics. Side effects. Adverse. Adverse means a side, reactions means effects, antibiotics means medications. Now you understand. Regarding Advice means guidance. Guidance regarding medication side effects. See here. Advice regarding medication side effects. Okay. Advice regarding medication side effects. Advice regarding medication side effects. See, every word is there. Advice, guidance, regarding, medication, antibiotics, side, adverse, reactions, effects. Everything is there. Everything is there. So now answer is confirmed. I hope you understand now what I was trying to explain. It's very, very important. Now, let's go to the next question. Question number 5. Question number 5. How to decide whether a patient should be hospitalized? So, somebody has some problem, pneumonia. If it is in the first stage, no need hospital admission. If it is in the second stage, no need hospital admission. If he is in the third stage, hospital admission is needed. If he is in the fourth stage, hospital admission is needed. If he is in the fifth stage, intensive care unit is needed. See the levels there. So how to decide whether a patient should be hospitalized? Should he be taken into the hospital or not? How to decide? Okay. So you will decide. How to decide? How can you decide a person whether he is pass or fail? That means you'll conduct a test. Testing means evaluation. Testing means assessment. Testing means examination. Testing means studying. Assessment. Testing. So how to decide? If you want to decide a person is okay or not, that means you have to test him. If you test him, if he passes, he is okay. If he fails, he is not okay. How do you decide? Through a test. That means you are doing an examination, exam, test, analysis, evaluation, assessment, examination, research, study. So you're doing something there. So that's very, very clear for you. Okay. That's very clear. So you will decide hospitalized, whether he should go to the hospital or not in the beginning stage. So you will assess if he is very serious or very weak, you will admit in the hospital. If it is normal stage, ordinary level difficulty, no need to join in the hospital. If it is not managed on his own, then you will admit in the hospital. If it can be managed with the help of the family and personally, then no need hospital admission. So admission will be given based on evaluation, based on assessment. First they will do some, measurements. They will assess. Then if they think his problem is serious, then he will be admitted in the hospital. Otherwise, some medication will be given and say, take this and stay at home, no need for admission because your condition is not serious. Okay, fine. So you know that admission, assessment, admission, and discharge. So discharge also based on assessment only. In between also, no discharge also based on assessment. First admission based on assessment we have seen so far. Then continuing, if the problem is still persisting, so continuing in the hospital. So when you assess after 2 weeks, still the problem is there, little less, but still the problem is there. It's not come to ordinary level. From 4th level to 3rd level or 2nd level it came. So he should be staying in the hospital. Continuation is a must. Now, for example, after 6 weeks, the level has come to 1 or 0 or 2, from 5 to 2. Okay, now the condition has come to 2, seriousness. From 5 to 2, fifth stage, fifth level to second level. So it decreased, the problem decreased. So now you need not stay in the hospital. We can discharge you because we know you don't need our help anymore, because the condition, the seriousness of the condition has lapsed, and now you can manage on your own. For that reason, why you should stay in the hospital? Never mind, you can be discharged today. So that's how. Okay, decision will be based on evaluate. For example, you will see a table. The table has 4 legs. Okay, a table has 4 legs. You can keep something on the table. So now you will decide, does it have 4 legs? Does it have a flat surface on the? So you will ask these questions. So you are conducting a test. You are researching, you are studying, and you are asking some questions. And in that questions, if the answer is yes, does it have 4? How many legs does it have? 4 legs. Table has 4 legs. This also has 4 legs. So 1 pass. The next one, does it have a flat surface on the top? Yes. Yes. So it is right. So 4 legs and flat surface on the top. Next, is it strong? Will it break if we put some weight on that one? Are the legs strong? Yeah, it can carry some weight. So this is a table. So you are testing, you are evaluating, you are assessing. Then only you will accept that something is needed. So test, you have to run some tests to decide. For example, a person has asthma and he does not know. He comes to the doctor and he asks, "Sir, I have some problem." So the doctor will run some tests. Then he will say, "You have asthma." So diagnosis is done based on assessment. Okay, evaluation, study, or some research. So that's how you have to think. Decision you will take based on questioning. For example, you want somebody to go to the market with you. Then you will ask, there are 3 brothers or 3 friends. Now who will go? Only one can go because I have a scooter and only it's a two-wheeler and only one can come. So I will ask, John, are you free? Now I'm going to decide who can go with me. John, are you free? Oh my goodness, I'm sorry, I'm not free. I have a lot of homework to do. This mad teacher, English sir, he has given a lot of work. That's it, finished. So he cannot go. I decided that he cannot go because I asked a question. And that is not favoring me. So I failed. So he cannot go with me. So I'm deciding whether this person can go. John can go with me or not based on that question. So John cannot go. That's done, finished. So I'm assessing, I'm evaluating, I'm checking, I'm asking questions and getting some answers. Then only I can decide what to do with this. So if he says, no, I don't have any work. I don't have any work. But what I'm thinking, I just want to go and water the plants, because yesterday also I did not water the plants. And if I don't water today, they will die. So I think I can come with you, but if you can wait for 15 minutes. No, sorry. Abraham, you cannot come with me because I have to wait for 15 minutes for you. No, I have to go now. Why should I wait for 15 minutes? What will I do in these 15 minutes? Sorry, you cannot go with me. Yeah, Rachel, what about you? Yeah, I have some work, but there is no urgency. I have to submit day after tomorrow. So all tomorrow I have 24 hours. So anytime I can do. Oh, so no problem. So I think you can come with me. Yeah, I will definitely come. So try to understand. So when she did not say I will come, but she said, I have some work that should be submitted day after tomorrow. Now, I don't think it's very important. So I am free. She did not say I will come. She said I am free. So based on these words, you can decide who is going with you. Nobody said I will come with you. Nobody said I will not come with you. But they have given their own explanation or reasons. One said I have homework to do. Another said for 15 minutes. I'm busy. They're not saying I will not come. They're not saying I will come. They're not saying I will not come. They're not saying anything regarding coming, but they're telling about their schedules. You ran a test. You asked some questions. They responded. So this is human logic. There is nothing to do with English or this is common sense. Most of the questions based on this one only. If you apply common sense, it's very easy for you to understand. You will decide only after asking questions. Now, for example, you have 1000 rupees. Now, what should I do with this 1000 rupees? So you'll ask questions. I have to save some money. I have to buy some bread. I have to buy a vehicle or something like that. I have to buy some books. So you will decide. Now, is this good? Is this not good? So you question like that and then you decide. This questioning is called assessing, examining, okay, evaluating, analyzing. So these words are related to assessment. These words are related to assessment. I'm teaching you the depth. Within 5 seconds, I can tell everything and all the answers and I can go off. You will think, oh, sir, explain. But no, that's not it. I want you to if I want to explain, I can explain in just 30 seconds. But I don't want to explain you. I want you to explain yourself in the future endeavors. In the future test, you have to analyze like this. Simon sir is not going to be with you every test, every day. No way. You should think like Simon sir. You should think in the same manner. You should analyze. You should evaluate. Then only you can decide whether it is A or B or C or D. If you study only, if you question like this, you can analyze. Then only you can decide which one is the right answer, A or B or C or D. You have to question yourself like this. Just running, going, searching for the answer. That's meaningless. That's meaningless. Utter flop. Waste of time. So you will decide based on assessment, based on questioning. Okay. You will decide. You will decide based on assessment. Okay. So for example, you see some marbles. So which marbles we can use, which marbles we cannot use. You examine them. Separate the broken marbles and separate the marbles which are intact, round. Okay. So that's how you decide which you can use and which you cannot use. So decide. Decide. Hospitalized. Should we give him admission to hospital or not based on your initial assessment? Remember that. So now if you see, the reason is, okay, assessment, admission and discharge. So there is a method. Now let us go and check our answer. So go to A. Go to A. Admission guide. Admission guide. Low risk home care. Moderate risk admission. 3 to 5 high risk urgent admission ICU care. That's it. So if you assess it is 1, no need admission. If it is 2, admission. If it is 3, 4, 5, it's high risk. 3 and 4, urgent admission. 5 is ICU. That is curve 65. Curve 65 at the age of 65 and above. Above 65. That is curve 65, we call it. You know it better. Okay. CURB 65. The line, first line. CURB. What do you mean by CURB? Okay, 65 means age 65. Age is above 65. Then, right? Think about all these things. So, based on that one. So that's very clear now. When should you join in the hospital? Based on risk level. More risk, hospital. The more the risk, the urgent it is. Less risk, no need urgency. You can put it at home. So the answer is right. Okay, the answer is right. Next question number 6. The underlying cause of some conditions associated with pneumonia. Associated with pneumonia. Now you see there, underlying cause. Underlying cause. It will take a little more time, but try to understand, because I'm not going to teach you 100 tests. I'll teach you only one test. Analyze this, understand the style, and apply the style everywhere. Everywhere I will not come to apply for you. One question maybe I'll explain. 2 questions maybe I'll explain. But I'll not explain each and every test like this. Sorry. You have to apply. You have to open your brain. You have to work it out. You have a problem, you have to solve. Method I will teach you. That's what I'm doing now. Apply this method and you solve your problems every day. Yeah. Now, next one. The underlying cause. The underlying cause of some conditions. What conditions? Medical conditions. Associated, related. So some medical conditions, 5 to 6 conditions maybe, or more than that. So the underlying cause of some condition, reason of some condition. What is this condition? Why? What is the cause of this condition? Now you understand. Now where you will go. You understand? Where will you? So underlying cause, conditions associated with pneumonia. These are the keywords, the most important words. The next one, operating word is cause. Cause. Condition, some conditions. Some conditions associated with pneumonia. Some medical conditions also. Pneumonia is a problem already. There are some other conditions associated with pneumonia, related to pneumonia, or associated with pneumonia. So now cause. That means what is the reason behind this? What is the reason behind this condition? Condition. Condition means, is it assessment? No. Condition means, is it information? No. Condition, is it procedure? No. Condition, here, complication. Cause of some complications, complicated conditions. The underlying cause of some complicated conditions, problematic situations associated with pneumonia. Now, you have to go to D. You have to go to D. Now, check it out there. In D, okay, sixth one, D. Now, how are you going to manage this one now? Okay. Conditions. Some conditions related to pneumonia. If they are normal conditions, you will not talk. Pneumonia is already a problematic condition, and some other conditions together, it will be a bigger problem. Associated, related. One problem is already there, another problem is, for example, one boy is there. He's a troublemonger, always troubles others. When you are at school, one boy always troubles you. Now, this one boy is already there, and because of this problem, somebody else has come and he also joined with him, and that fellow also has a problem. So, this is a double problem. This is a bigger problem. So, that means already pneumonia is a problem, and another person coming and join. For one troublemonger is there. So, okay, somehow we can manage or escape. But another person is there. They are together now. It's a bigger problem. So, it's a complication. It's a serious concern because both of them are related now. Both are troublemongers. If they are together, one person means somehow we can escape and go, but two persons are there. You cannot have a chance to escape like that. So, complicated condition. Now, complicated conditions are there in text D, not in assessment. Assessment is about pneumonia. Information is about pneumonia. Procedure is about pneumonia, but complications are related to pneumonia. Some other complications in addition to pneumonia. A is only about pneumonia. B is only about pneumonia. C is also only about pneumonia. A is assessment of pneumonia. B is information regarding pneumonia. C is procedure, thoracentesis procedure for pneumonia. And D is also for pneumonia, in addition to some other problems. There are other problems also in question D, not in A, B, C, but in D, there are some other problems. So try to understand like this. Complications are other causes, other conditions, associated conditions. Yeah. Complications. Complicated conditions. Complicated conditions, some complicated conditions. You go and see there, you'll get everything. So, complications of pneumonia are list of conditions that explain their causes. Bacteremia, caused by multiplication of bacteria in the blood, same thing. Pleural effusion, accumulation of fluid in the pleura. So, these are all you have seen. What is the cause of this condition? That is the explanation of the condition. Let us see here now. Yeah. Bacteremia, what is the cause? What is the reason behind this? Present. This is definition and also reason, explanation. Presence, multiplication of bacteria in the bloodstream is called bacteremia. So what is the cause? Bacteria. Bacteria. So condition is bacteremia and the cause is bacteria. So try to understand this. Okay. Try to understand this here. The condition is bacteremia and the cause is bacteria. Okay. Cause is bacteria. Now, ARDS is the complication. The cause is fluid. Fluid is the cause. Okay. Fluid is the cause. Right. Pleurisy. Inflammation is the cause. Right. Lung abscess. Pus is the cause. Pus. Lung abscess is the condition. Pus is the cause. That's it. Yeah, fine. Next. Next one. What type of patient? The type of patient for whom the standard evaluation will need adapting. Evaluation. Evaluation. Evaluation means what? Assessment. Evaluation means assessment. Assessment, evaluation, signs and symptoms, examination. Okay. So, evaluation, evaluate means assess. Evaluate means assess, judge, analyze, analysis, evaluation, assessment, judgment, diagnosis. All these are synonymous. So standard evaluation will need adapting. Okay. Now you see here. The type of patient for whom the standard evaluation will need adapting. Okay. Will it be there in information? Will it be there in assessment? Okay. Will it be there in procedure or will it there be in complication? Evaluation means assessment. Evaluation means assess. You have to identify one word which is related to the main words. Okay. Evaluation means assessment. Evaluation means assessment. Okay. This is how you have to guess. If you guess like this, it will be easy for you. So, now let us discuss this one. So, Anuja, Dinusha, Dunisha, Shamali, Shams, Sinsi. Okay, good, 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 good. Now, one by one. One by one, share your experience. Yeah, Dr. Shams.
Bale.
Yeah, share your experience, please. How was the session? What was helpful? What new things you learned? And why it is useful?
I think if thing like this, it is quickly you find the information uh, related to which one, A, B, or C.
Okay, good. Next, Dunisha.
Hello, sir. Yeah,
Yeah.
today I understand.
Can you talk little loudly? Did you have your breakfast,
No,
Dunisha?
no. Yes.
Yeah.
Before I mark the keywords, but I didn't do that steps. So today I understand when I explain or when I try to understand according to your method is very easy and clear.
Okay. So the logic is you have to learn the synonyms. Synonyms means meanings. Right. Next, Dinusha. Dinusha.
Hello, sir.
Yeah.
I got what you said, but the thing is, I just came out from my birthday joined the session from the fourth question. But I got what you said, but I never tried this way because I tried to go through the all question form and try to get everything pulled out before I go into the questions. But I tried to do like this way. So I think I got what you said. I'm sorry, I'm still in my bus.
Yeah, okay, fine. Next, Shamali.
Sir,
Yeah, share
I
your experience, Shamali. What new things you learned and why it was beneficial for you?
yes, sir. I used to do this method, sir, but sometimes I'm struggling to use this method when sometimes I just thinking this one is with the information when I do a part like that, then but sometimes I'm struggling to choose the correct answer when I use this method also. But today is much clear. Then I will try to. That's I think this. What are the keywords and then operations, operating words that mean that questions is much helpful for me to get the answer. That's much better. I will think that your way is good, and then I will try to again to this way to find my answer.
Yeah, thank you very much. Cincy.
Hello, sir.
Hello, Cincy.
Hello, sir. Today my all answer correct, sir. But actually, I didn't get the answer like this. Always, I'm going through the every part and I'm checking that one. But now I understand that method is very easy. But we can save our time. Thank you, sir.
Right. Next, Anuja.
Yes, sir. I learned how to find out answer from using synonyms. Thank you very much, sir. So I will try it do the next text as well. Thank you very much, sir.
Right. Very good. So, we have completed the first part, first 7 questions. We have another 2 sets, that is multiple choice questions and fill in the blanks. So, we'll take a short break and we'll continue. How many of you are ready for the second round? Just type there, second round. Second round. Type your names. Second round. How many of you are interested for the second round? Yeah. So Shams is interested. Yeah, we are going to have 15 minutes to 20 minutes break. Afterwards, we'll have. Because you also should have for lunch, na? Something fast. Yeah. Shams, Dinusha, Sinsi, Dunisha. Okay, good, good, good. So we are going to start after 20 minutes. So let us take 15 minutes to 20 minutes. Okay. So break 15 to 20 minutes. Break. 15 to 20 minutes break. Yeah. And the same link. We can join in the same link. Yeah, that's fine. So 15 minutes. Yes, so all of you can subscribe, like, share, and comment on the video. Whatever you feel, that gives us extra motivation to move forward with more samples, examples, and model lectures. So please do subscribe. Support our work. A little goes a long way. Share this video generously. Provide your valuable feedback in the comment section. For registrations, contact +91 98 778 67360. The current batch is full, but still you can register for the coming batch. So for personal training, you can contact me on this number +91 98778 67360. Thank you for watching this video. Have a nice day.